Lyme disease is one of the most common tick-borne illnesses in the U.S., according to the CDC. But its diagnosis and treatment can be challenging because of its diverse manifestations and the limitations of blood tests. Well, now a familiar face to our show has made it her mission to spread awareness of Lyme disease after her daughter lost her life to the illness after a decade-long battle. Bedwatch Today's Connie Tran has her story.
When Jody Hudson is in her peaceful backyard, she is most connected to her daughter, Alex.
She was a typical girl. She loved athletics as much as she loved the girly girl and dance stuff and whatnot.
Alex was only 22 when she left this earth. Her mother says it was complications from Lyme disease and mast cell activation syndrome that took her life.
Through her death, she breathed life into me. She gave me purpose, and I knew what I needed to do, which is to form this foundation and educate and really create awareness for others.
The Hudson family's battle with Lyme disease began when Alex was in elementary school.
She was getting joint pains and she was having inflammation.
Doctors said maybe Alex was being overworked in sports. She would put ice on her joints and take ibuprofen to relieve the pain.
It was very severe. I mean, she would be crying, and you just think as a parent, it's growing pains.
By the time Alex started high school, Jody says she couldn't run and play sports anymore. Adding to the frustration of a mystery diagnosis, Alex began having digestive issues and food allergies. Alex was finally diagnosed with Lyme disease in May of 2017.
After doing the whole family history, said, Mrs. Hudson, have you heard of tick-borne illness? And I said, what is tick-borne illness? And he explained it to me, and he said, Alex has all the classic symptoms of having a tick-borne illness.
Jody says her daughter wanted to be the face of Lyme disease and show people you can fight it and make it. But
when she knew that wasn't going to happen, she said, Mom, she goes, I want you to basically take my torch, and I want you to make sure that you create awareness for other people. So maybe in Lyme Awareness Month, that's what I'm going to do. I want to create awareness. I want to have information out there for parents and other people that have symptoms.
Alex died in March of 2018, and Jody started the foundation in Alex's name just 3 months later. Her mission is to make people aware of the signs and symptoms of Lyme disease, which can include fever, rash, facial paralysis, and arthritis.
I don't want anybody to go through what I had to go through with Alex and what we went through together.
Through awareness, education, and funding, the Alex Hudson Lyme Foundation will carry on Alex's wishes of bringing awareness to Lyme disease and raising funds for treatment and testing.
Well, continuing our Lyme Disease Awareness Month coverage, our next guest is someone who is currently living the harsh reality of having Lyme disease. Local mom Jessica Devine was bit by a tick up at Shaver Lake back in 2012. Since then, it took 3 years and visiting more than 30 doctors to be officially diagnosed with Lyme disease. She shares her story today in hopes of helping others catch the disease early, which is crucial. Please welcome Lyme Disease Awareness Advocate Jessica Devine to our program. Jessica, always good to see you.
It's always good to see you too. Thank you.
And I know you don't feel great, but you do look great. So
thank you.
Thank you
hide
for
it well.
being here. You do. So I think in watching Jody's daughter's story, and every time we talk about Lyme, it just is all about awareness and getting the message out there because it is such an invisible disease, right?
Yes, it gets misdiagnosed a lot. You know, I went to 30 doctors that you get tagged with other diagnoses and you start chasing that diagnosis, and it's not that, or you get labeled as a hypochondriac or something like that, when that's not the case.
Yes, you know yourself, you know your body, and you know something is off.
Yes.
So let's talk about when you knew.
Well, you mean when I got bit or when I got diagnosed?
When you got bit.
When I got bit at Shaver Lake on a family trip. A couple hours after it must have been on me for about 2 hours. So it takes no time to transmit the disease. Anything else that you see online, it's not good information. But when I took it off, within about 2 hours, I was having body tremors, like body seizures, massive headaches. It was almost like the flu times 10. It was severe, and then it moved into basically lots of pain. This is a very painful disease.
Right.
And it's hard to describe how much pain is involved.
So you remember taking off that tick yourself?
Yeah, I removed it off of my abdomen, and I removed it wrong. Now that I know,
right way?
You should really grab it at the base of the skin, right where the head is. You don't twist and you pull out steady and straight and save the tick and send it for testing, because that's a good way to find out what it carried. And then, you know, since the tests aren't good, if you have the tick test, then you'll know what it carried, and it's a better approach to treatment, in my opinion. Always save the tick.
I never thought of that, so that
Yeah.
is crucial. Okay, so if we do find a tick on ourselves, we get it as good as we can off, and then save that tick.
Yes, save it.
So knowing what you know now, thanks to all of your advocacy work, would you have gone to the doctor right after that, had you known?
I did.
You did?
Yeah, I went 2 days after the bite, and I never stopped going. I have family that would vouch for this. I went every week for years.
Wow.
I mean, I knew something was going on in my body. I knew it was spreading. I knew it was severe, and I knew that they were wrong, that that wasn't anxiety. It wasn't that I wanted to be sick. I truly had something spreading throughout my body, and it did. I mean, it's in my heart, it's in my brain now.
Yes. So what have you learned about Lyme after all these years and all this research I know that you've done?
Is that it's hard to diagnose, and there's a lot of mistreatment in the medical community, because I think because they don't know what's wrong with us, we're judged, and that's very hard for the Lyme community, because we just want to be heard. Because if we get diagnosed soon enough, there's treatment, and the suffering, it doesn't have to be like this.
Yes,
and
yes.
people don't have to. I have a friend that had a heart transplant from Lyme disease. I have a friend that's signing up to do death with dignity in Oregon because it's so severe.
Wow.
So we need it's just the awareness is what's going to
Yes,
get there.
yes.
It's improve the testing, and for people to understand it's not a disease. You just go, oh, it's just a tick bite. No, it took my life, and it's taken my friends' lives.
Wow. Well, I know that you are now in charge of the Fresno Lyme Disease Support Group.
Yes.
Which is so key to get people talking about Lyme, if you know someone, if you have the disease. And also, I know you guys offer great resources about how to talk to doctors.
Yes.
Because that's a big thing that you learned, is fighting for yourself.
Yes, you have to be able to find a doctor, and I will help anyone. I will help them find a doctor. I'll tell them if they get a tick bite. You can even find me on Facebook. That's all I do with my day, because I can't do much else, but I can help prevent other people's suffering.
Yeah.
Infectious disease doctors will not be the way to get help in this town or anywhere. It really is, you need a Lyme literate doctor. That's who does it. 25 infectious disease doctors in town wouldn't let me walk in the door. So that I can help people. I can help you get better and get in the hands of a doctor that can do something.
Wow. Well, we are so appreciative that you are here spreading the message. As always, Jessica, thank you for sharing your story. Thanks for being vulnerable, and we wish you just happiness and health all the days forward.
And thank you for what you do for the Lyme community. We
Yes.
really appreciate it.
Well, thank you. It means a lot to us. All right, Jessica, take care.